Hi, good evening. My name is Gaylon Alcaraz, and I am the executive director of the Chicago Abortion Fund. And tonight I am going to be talking about reproductive justice. And for those of you that don't know what that is, we're going to go into that. We're also going to give you information on how you can contact us if you need assistance, volunteer opportunities, and so forth. So, for those of you that are tuning in for the very first time, Chicago Abortion Fund is a fund. We help poor women pay for their abortion procedures. Poor women that are seeking second trimester abortion procedures. And second trimester starts at 12 and a half, 13 weeks. And one of the things that I encountered when I started 7 years ago was that we were a direct service organization. And being a community organizer, I really began to think about why weren't the women that we were serving involved with our organization. And so in 2007, we began to engage those women, women that called our fund seeking assistance. And we brought them back to the table, provided them with leadership development and training, empowerment, so that they could go out into the communities and become advocates and peer-to-peer educators. What I didn't realize at that time was that we were working from a reproductive justice framework, even though we did not have language around that. Reproductive justice was a term coined back in the 90s by Sister Song at a Black Women's Caucus, like 1994. And what it did was it merged the concepts of reproductive rights and social justice together. And the purpose of the reproductive justice framework is to support women in their entire lives. And so, really support them in their right to have children, to not have children, and to parent the children that they already have in healthy and safe environments. And so it encompasses a lot of a woman's, from her environment to her health, to economics. All these things are part of the reproductive justice framework. And so in 2007, although we were engaging the women, we were bringing them back, we were providing them with some supportive services and linkages and referrals and bus passes and so forth, we didn't look at that as a reproductive justice framework. In 2012, as part of our strategic plan, the board and myself worked together to incorporate the framework into our mission and our values, our statement of values. And so right now we are currently an abortion fund that works from a reproductive justice framework. And we think that that is extremely important because abortion is just a narrow focus of a woman's life. It's something that a woman makes a decision on, but we have to look at the conditions of a woman's life as well. And so that's why we are, taking a stance and doing this work from this framework. What it also addresses is the injustices a woman faces in her life. And so if she lives in poverty, she lives in a crime-infested neighborhood, or she lives in a neighborhood that doesn't have fresh fruits and vegetables, so a food desert, or she doesn't have health care centers that are easily accessible in her neighborhood, those are all a part of the injustices that a woman faces that will impact her reproductive health. And so those are some of the things that we try to address, and we try to, go out and make communities aware of this framework, make sure that communities are aware of their elected officials in their areas and supportive services that are in their areas. So those are some of the things that we do, and as a part of the reproductive justice framework, because if a woman lives in a neighborhood that's not safe, it could be possibly targeted for sexual assault that impacts her reproductive health. If she is not eating healthy, that impacts her reproductive health. If she doesn't have accessible health care or affordable and safe birth control methods in her area where she can get to, that impacts her reproductive health. So these are all injustices that will impact her. And so that's why it's really, really important for us to work from that frame. I am going to go ahead and flip over to our overhead though. If you have questions, please give us a call. And you can take a look at our overhead if you need assistance. And that's the Chicago Abortion Fund at 333 West North Avenue. And the phone number is 312-663-0338. And there is the website for you. And if you just want to shoot us an email, feel free to at info@chicagooabortionfund.com. So, in talking about reproductive justice, there has been, even though, a lot of people still have not heard from it, it has been a mainstream movement, a grassroots movement from the 90s until now of organizations, social justice organizations, reproductive justice organizations, working on the ground to try to mainstream this and work from this framework and bring this framework and the ideas to the communities and to elected officials. And so we're continuing to do more mainstreaming around it, but we think that it's really, really important to not just focus on reproductive rights, because abortion is legal now, but it's not accessible to a whole lot of women. And so there is a narrow focus there. We can't just focus on abortion. We have to focus on, if a woman chooses to continue with her pregnancy, does she have all the social supports necessary to have a healthy family? If she, already has children, does she have the social supports necessary to parent those children that she has? For example, do they have health care? Do they have good schools or schools in their neighborhood that will service, the children that she has? So does she have, quality, food sources? Does she have quality health care? So all these things are really extremely important, and these conditions impact the decisions that a woman may make around her family. And so, it's easy to say, don't have an abortion, or, give up your child for an adoption. But, those are things that someone can easily say from their mouth. It, still does not, the decisions that a woman makes, those are hard decisions for her. And so, we have to take those things into consideration. I encourage questions. I will talk a little bit about the Chicago Abortion Fund right now. So, what we do is we help pay for their procedures. Every week, we open up our client line, and women call in seeking assistance. And so we help them pay for that. We take down demographics, and then we fax over an approval form to the clinics that they're going to be going to. And the clinics invoice us at the end of the month. And so that's how we help women. They do come up with a portion of their procedure, and then we pay a portion. Sometimes we're also negotiating with the clinics, and as well as, seeking other funds around the country to help these women pay for their procedures. So they go and they have their procedure, and then what we do is we do a series of follow-up calls with the women. And so we'll call them the week after to make sure that they're okay and how their procedure went. And then we'll also out a post-abortion package that has a lot of information in it, from condoms and dental dams and lubricants to brochures on sliding scale health care and birth control, affordable housing, anything that they've mentioned in their first call to us that they need. For example, if a woman is living in a shelter and she's said that to us, then in her post-abortion package, we're going to also include like housing information. If she's, mentioned that she doesn't have health care, we'll also include in her package the pink card application, and then walk her through the process of how to fill that out in one of our follow-up calls to her. So that goes out, and then we'll do a second follow-up call about a week and a half later, just to make sure that she got the packet, if she had any questions about it, and if she had any concerns or anything that she wanted to talk about to us. After that, we will contact her again, and that's when we begin to talk about reproductive justice and how it impacts her life, and why she can't pay for her procedure with a medical card, and the difficulties not just her, but a lot of women just like her are having accessing reproductive health care. And so from that conversation, we began to really engage them and hopefully get those women to come back to the table to help us do the work for other women as well, so educating the community. So those are some of the ways that we get the women into our organization. We have to say reproductive justice is extremely, extremely important, because without access, there is nothing. If you don't have providers, if a woman can't pay for it, then having abortion be legal, a legal right, means nothing to that woman. And so that's an injustice. And it's oppression as well. And so one of the ways to work towards ending that reproductive oppression is to work towards a reproductive justice framework that encompasses the entire woman's life. I'm going to switch over to the overhead again, and feel free to call CAN TV if you have questions at 312-738-1060. I'd be more than happy to answer those for you. But right now, here's the overhead if you need some assistance or you contact us off the air.